What to do when you get injured or you have a symptom of an injury. And then being a more mature or vintage type of athlete, I'm always combating injuries because obviously I'd rather wear out than rust out. And at any one particular time, I'm always battling one or two injuries, no matter what part of the gear. It just seems to move around. So today's topic is, how do you handle muscle strains? Now, I tend to get them in the calf when I'm, because my sport has involved a lot of jumping and a lot of bouncing in the form of fighting. So the calf gets a bit of a workout, the gastrocnemius. And you tend to more experience muscle strains in what we call biarticulate muscles or two joint muscles. For example, the gastrocnemius goes across the ankle and the knee joint, the back of the knee joint, because it moves across two joints, sometimes working in opposing positions or opposing movements. It can create a fair bit of strain on the muscle. So what do you do? First of all, you may be lucky where you may get a little bit of a tinge or a tweak or a twang, where you get a little bit of feeling, you go, oh, I feel that, and it's like one of the fibers just popped, a few fibers pop. It's like a rope, some of the little fibers start to pop and you can actually feel that. So coming from a mature athlete, also very much educated in this particular area, the first thing to do is to stop. Now, you're better off stopping, resting it, letting it recover and taking a few days off or a few days easy rather than trying to push through it, and that twing turns into a twang, into a twat, and all of a sudden you got a significant muscle strain, and now you're forced to take not a few days off but a few weeks off. So you have to be smart, you have to listen to the body, you have to listen to the symptoms, because if you don't, the body will start to scream louder. So when you get a minor strain, a minor muscle strain, take it off, stop bouncing on it, stop using it, still keep training, doing other activities, and let that part heal. Now, how do you heal it? You may want to take, first of all, ice is a good thing. You know, it vasoconstricts everything and, you know, decreases inflammation and promotes the healing process. You may want to take some anti-inflammatories, non-steroidal anti-inflammatories if you're not allergic to them, and then do some passive stretching in that particular area. So when it does heal, it heals more in the lengthened position rather than a short position that can actually make it tight. So when you go back to training, you now got a tight muscle which is more likely to be strained again. So the first thing to do is stop. Ice, light stretching, passive stretching, anti-inflammatories. Keep training, do other body parts or other movements, but unload that particular area. And then when you get back into training, just slowly introduce your training over a period of a week until you build the intensity up. So don't be too keen to get in and start sprinting or jumping or clapping or pushing, whatever it might be on that particular body part. So that's when you get what we maybe call a grade 1 muscle strain. It may take up to a week just to settle the area down. Now you may get up to a grade 2 where that twing turns into a twang, and now you've got quite a number of muscle fibers that have been strained, and obviously now you get significant pain and you can't actually move. You know, you can't use that muscle, therefore you're pretty much immobilized. Now that's more significant when that happens. So same approach, rest it, ice it, lightly stretching when the inflammation goes down, non-steroidal anti-inflammatories. You may want to go to physio or chiro or whatever health professional you go to try to accelerate that healing process. But now you're going to have to be more patient. Now it's not days off or a week off. Now you're going into the multiple weeks, and it can take up to, you know, 3, 4, 5, 6 weeks for that body part or that muscle to fully heal. So you've got to be patient again. But many times that happens when you try to push through the grade 1 or that little tweak, and it turns into a twang. Now when it goes to grade 3, a twat, this not scientific terms obviously, now you've got a complete muscle tear, and that's very significant, and now you may even need some surgical repair. So you certainly don't want to get to that stage, but you may get to that stage progressively if you ignore grade 1, grade 2, and eventually gets to grade 3, or that will happen where you get a significant impact through a sporting movement, or an impact through a weird tackle in playing football or something like that. So that's quite significant, needs proper rehabilitation with an allied health professional, a therapist in some form. So my suggestion is listen to your body. If it's feeling a bit tired or a bit awkward, then rest it an extra day, do some light stretching, and train when your body feels ready to go. Maybe you have to sort of differentiate between laziness and, you know, tiredness or fatigue. But if once you get that line pretty well clear, then you sort of know what to do, whether to load or to unload. But if you do continue to load without unloading and letting it recover, then the body will soon shut itself down. And that would be no cow poo.